What do high ESR and CRP mean for rheumatoid arthritis? Imagine your body is like a busy city, and inflammation is like traffic congestion that slows everything down. When you have rheumatoid arthritis, your immune system mistakenly causes inflammation in your joints and other tissues. Blood tests called erythrocyte sedimentation rate and C-reactive protein help doctors see how much traffic is happening inside your body. The erythrocyte sedimentation rate measures how quickly red blood cells settle at the bottom of a test tube over an hour. When there's more inflammation, the red blood cells tend to stick together and settle faster. So, a higher ESR suggests more inflammation in your body. Normal ESR values depend on your age and sex, but generally, low numbers are expected in healthy people. In rheumatoid arthritis, if your ESR is elevated, it often indicates that your disease is active and your joints may be inflamed or swollen. C-reactive protein is a different marker. It is made by your liver in response to inflammation. When your body detects inflammation, CRP levels rise quickly. Because it responds fast and drops when inflammation decreases, it is a good marker for recent or ongoing inflammation. Normal CRP levels are usually below 10 milligrams per liter. If your CRP is high, it means your body is actively fighting inflammation, which often correlates with joint pain, swelling, and potential damage if not managed properly. Having high ESR and CRP levels in rheumatoid arthritis generally means there is active systemic inflammation. This inflammation can cause joint pain and swelling, and if it continues unchecked, it might lead to joint damage over time. However, it's important to remember these markers are not specific only to rheumatoid arthritis. They can also be elevated in infections, other inflammatory diseases, or even some chronic conditions. That's why doctors use these blood tests alongside other tools like rheumatoid factor, anti-CCP antibodies, physical exams, and imaging studies to get a complete picture of your health. In practical terms, these tests help doctors diagnose rheumatoid arthritis and monitor how active the disease is over time. If your ESR or CRP levels are high, your healthcare provider might consider adjusting your treatment to better control inflammation and prevent joint damage. Conversely, if these levels are low or normal, it could mean your current treatment is effective, but it doesn't rule out disease activity entirely, especially since some people with active rheumatoid arthritis can have normal blood markers. It's also worth noting that these tests are just one part of the puzzle. Some people with rheumatoid arthritis may have active disease but normal ESR and CRP levels. That's why a comprehensive assessment, including symptoms, physical exams, and other tests, is essential. Always discuss your results with your healthcare provider, who can interpret them in the context of your overall health and guide you toward the best management plan. In the end, high ESR and CRP levels tell us there's inflammation happening inside your body, and managing that inflammation is key to controlling rheumatoid arthritis and maintaining joint health.